I'm going to be talking about vasculitis today. So there's several different types of vasculitides, and if we just simplify it into three patterns, it's going to be much more easier to understand vasculitis. So there's a large vessel vasculitis, which is basically head or pulse symptoms, medium vessel vasculitis, which is organ ischemia or aneurysms, and then small vessel vasculitis, which is usually a rash, kidney involvement in the form of glomerulonephritis, and lung involvement such as pulmonary hemorrhage. So the large vessel vasculitis, think of head and pulses as a good mnemonic. So giant cell arteritis is one of the two large vessel vasculitis that you have to know about. Typically presents with an elderly patient above the age of 50, new onset headache, jaw claudication, and then there's vision loss, or the ESR is elevated, and that's giant cell arteritis for you. And then the other large vessel vasculitis is Takayasu's arteritis, which happen in younger women. They usually present with weak pulses, arm claudication, and unequal blood pressures between the various arms. So large vessel vasculitis either gives you old head pain, which is in giant cell arteritis, or young weak pulses, which is Takayasu arteritis. Medium vessel vasculitis, think of ischemia without glomerulonephritis, and so the classic one is polyarteritis nodosa, also known as PAN, P-A-N. Patients with prior hepatitis B, abdominal pain, neuropathy, such as a foot drop or an arm drop, hypertensive renal disease. And the key thing here is that there's no lung disease in polyarteritis nodosa. Kawasaki's disease, one of two important vasculitides to know that occur in children. The other one is IgA nephropathy, which we'll talk about in a second, IgA vasculitis. But you have a child with fever and mucous membranes involvement, and several, maybe 5 days of high fever, and strawberry tongue, and the complications of that are coronary aneurysm. And to prevent that is to give aspirin and IVIG. Berger's disease, you have young smokers with painful fingers or toes, and then you have and the important thing is that there's no glomerulonephritis, so there's no RBC cast, there's no RBC cast, which is basically pathognomonic for glomerulonephritis for the purposes of this test. And so just know that polyarteritis nodosa is the most important one in this category. Small vessel vasculitis, think skin, kidneys, and lungs. So you have granulomatous with polyangiitis. So you have sinus disease, lung disease in the form of hemoptysis and glomerulonephritis. Microscopic polyangiitis, where you have lung and kidney disease but no sinus disease, and we're going to talk about this a little bit, where you how to differentiate the two. And then you have eosinophilic granulomatosis with polyangiitis, which is asthma and eosinophilia plus vasculitis. So you can get skin involvement, nerve involvement. And then you have IgA vasculitis, which is the second of the two important pediatric vasculitis to know, which is palpable purpura, belly pain, and joint pain, and hematuria in the form of glomerulonephritis. And so, you have small vessels that are leaked and inflamed, and you see purpura, glomerulonephritis, and pulmonary hemorrhage. Okay, so just going through all of these vasculitides one by one. Is the patient old with headache or vision symptoms? If so, think of giant cell arteritis. What's the next step in management? Steroids before temporal artery biopsy. Is a patient young with weak pulses? Think of Takayasu's. Is there hepatitis B, abdominal pain, neuropathy, and no lung disease? So that should be polyarteritis nodosa. Is there sinus, lung, and kidney involvement? So this is GPA. Is there lung and kidney but no sinus involvement? So this is microscopic polyangiitis or anti-GBM. They look like each other. Is there asthma and eosinophilia? So this is eosinophilic granulomatous with polyangiitis. Is it a child with fever and red mucous membranes? Think of Kawasaki. Is it a child with purpura, belly pain, joint pain, and hematuria? Think of IgA vasculitis. Is it a smoker with painful fingers and toes? Think of Berger disease. Okay, and so just briefly, we're going to talk about the ANCA-associated vasculitis, which is GPA, EGPA, and MPA. So GPA goes with C-ANCA, which is also known as proteinase 3. And a good mnemonic to remember that is think C for cavitary disease. And C is also similar to a backward appearing 3. So C-ANCA goes with proteinase 3, and it only goes with GPA. So that means that EGPA and MPA go with P-ANCA, and P-ANCA is same as myeloperoxidase or MPO. And so this is basically it for vasculitides. And if you're struggling with Step 2K studying and want to discuss strategy, email me at dr.k@medexamcoach.com. I also offer a 500 question knowledge builder quiz link in the description, or you can copy this link, and then just any comments appreciated.